Bismillahirrahmanirrahim. Assalamu alaikum. I am Professor Dr. Javed Iqbal FAROOQI, and you are watching my YouTube channel, Health Education. Many of you have already watched my earlier videos on fatty liver disease, which has helped thousands of people understand their condition. But medicine keeps evolving. And so today, we begin the updated and improved version of this topic. Clearer, simpler, and based on the latest medical information. So let's start with the very basics. What is fatty liver disease? How it develops? And what you need to know before it causes problems. So the question, what is fatty liver disease? The answer is, fatty liver simply means that extra fat starts to accumulate inside the liver cells. Normally, a healthy liver contains very little fat, less than 5% of its weight. But when fat becomes more than this, we call it fatty liver disease, or in medical terms, hepatic steatosis. Think of your liver as a clean, efficient factory, constantly processing nutrients, removing toxins, and storing energy. When too much fat gets deposited in that factory, it slows down the work. Over time, it starts affecting the liver's normal functions. So the next very important question, how the liver becomes fatty? Answer is, there is not just one reason. It is usually a combination of lifestyle and metabolic factors. When we eat more calories than our body needs, especially from sugar, refined carbohydrates, and unhealthy fats, the liver starts converting that excess into fat. At the same time, if the body becomes resistant to insulin, which is a hormone that helps control sugar, the liver begins to absorb and store even more fat. So, slowly and silently, fat starts building up inside the liver cells, and you may not feel anything for years. What are the causes of fatty liver disease? Let's look at the main causes that make the liver fatty. Number one, obesity. Being overweight is one of the most common cause for fatty liver disease. Then uncontrolled diabetes, especially type 2 diabetes and insulin resistance. Then comes high cholesterol and triglycerides. These fats circulate in the blood and get stored in the liver. Then unhealthy diet, excessive use of sugary drinks, junk food, white flour, and fried foods leads to development of fatty liver disease. Then lack of physical activity. When you do not burn calories, your liver starts storing them as fat. Then the alcohol consumption. This can directly damage the liver and aid to fat accumulation. The seventh cause is certain medications or rapid weight loss. In rare cases, these can also contribute to the fatty liver disease. The most common form we see now is non-alcoholic fatty liver disease, which happens even in people who never drink alcohol. Just a brief overview of symptoms and complications of fatty liver disease. The tricky part is fatty liver usually has no symptoms in early stages. Most people find out accidentally during an ultrasound or blood test. But as the disease progresses, you may start feeling fatigue, discomfort or heaviness on the right side of the upper abdomen, loss of appetite or general weakness. If ignored, fatty liver can slowly lead to liver inflammation, that is called NASH, then fibrosis, and eventually cirrhosis or liver failure. In some cases, it may even increase the risk of liver cancer. That's why early detection and management are extremely important. Now, brief introduction to the diagnosis and treatment. Fatty liver is usually diagnosed through ultrasound, liver function tests, and sometimes fibroscan or MRI if needed. In most people, lifestyle modifications is the first and most powerful treatment. Healthy diet, regular exercise, weight loss, and control of diabetes and cholesterol. In upcoming videos, we shall discuss each of these in detail, including what to eat, what to avoid, and how to reverse fatty liver naturally and medically. So viewers, to summarize, fatty liver is common but preventable and reversible in early stages. If develops, it can lead to very severe complications. Fatty liver disease develops silently due to unhealthy diet, inactivity, and metabolic imbalance. The key is awareness, timely checkups, and lifestyle correction. In the next videos, we will explore symptoms, stages, tests, diet, and complete treatment plans step by step. So stay tuned. If you found this video useful, please like, share, and subscribe to Health Education and help spread awareness for a healthier Pakistan. See you in the next episode. Stay informed, stay healthy. Khuda Hafiz.